When most people think of strokes, they imagine sudden, random health catastrophes, the kind of events you hear about on the news that happen to someone else. However, as a physician specializing in neurological health, I can assure you that strokes are far from being purely unpredictable. In fact, many strokes are directly connected to small, everyday habits that often go unnoticed, especially in the critical morning hours. In a recent presentation at Parkview Health Clinic, I outlined 7 common morning habits that increase stroke risk, along with practical, brain-saving solutions anyone can implement. These tips are especially crucial for older adults, whose blood vessels and brain resilience may not be as robust as in younger years. 1. The morning rush. Jumping out of bed too fast. What happens when you wake up and leap out of bed immediately? Your body has little time to adjust to the sudden change in position. This rapid movement can cause a temporary drop in your blood pressure, a condition known as orthostatic hypotension. It's the reason some people feel dizzy or lightheaded upon standing. Why it matters. For younger people, the body usually compensates quickly, but for seniors or those with stiff or narrowed blood vessels, this sudden drop can reduce blood flow to the brain significantly. Reduced cerebral blood flow means your brain cells temporarily get less oxygen and nutrients, a dangerous situation that can trigger or contribute to a stroke. What you should do instead. I recommend the simple 60-second rule. When you wake up, first, stay lying down and take several deep, slow breaths to wake your body gently. Then, slowly sit up on the edge of your bed and stay seated for about 30 seconds. Use this time to focus on your breathing and allow your blood pressure to stabilize. Finally, stand up slowly, holding onto something sturdy if needed, and remain still for another 30 seconds before you begin walking or moving around. The small pause allows your circulatory system to adjust safely, preventing dangerous drops in blood pressure that could jeopardize your brain health. 2. Reaching for coffee before drinking water. What happens? It's a common habit to reach for your morning cup of coffee immediately after waking up. Coffee is a beloved ritual, and its stimulating effects are often welcomed. However, coffee is also a natural diuretic, meaning it increases urine production and promotes fluid loss. Why it matters. After 7 to 8 hours of sleep, your body is naturally dehydrated because you haven't consumed fluids for several hours. Drinking coffee first thing actually worsens this dehydration. Dehydration thickens your blood, increasing its viscosity. Thicker blood flows less easily through your arteries and veins, raising your blood pressure and increasing the risk of blood clots, a major cause of stroke. What you should do instead. Start every morning by drinking a large glass of room temperature water, approximately 12 to 16 fluid ounces, about 1.5 to 2 cups. Water rehydrates your body, thins your blood, and helps lower your blood pressure before you consume any caffeinated drinks. Once you've properly hydrated, you can enjoy your coffee without putting your brain at unnecessary risk. 3. Eating a high-sodium breakfast. What happens? Many breakfast options, even those marketed as healthy, contain more sodium than you might expect. Processed cereals, packaged whole grain toast, breakfast sandwiches, and even flavored yogurts can have hidden salt. Why it matters. Sodium causes your body to retain water and pulls fluid into your bloodstream, which increases your blood volume and raises your blood pressure. Since blood pressure naturally tends to rise in the morning, consuming a high-sodium meal during this vulnerable period can push it even higher, putting extra strain on your blood vessels and heart. What you should do instead. Become a sodium detective by reading nutrition labels carefully and aiming to keep your total daily sodium intake below 1,500 milligrams, which is the recommendation by the American Heart Association for people at risk of heart disease and stroke. At breakfast, focus on incorporating potassium-rich foods such as bananas, avocados, spinach, sweet potatoes. Potassium helps counteract sodium's effect by promoting the excretion of excess salt through urine, thus helping to regulate your blood pressure. 4. Ignoring minor warning signs. What happens? It's easy to dismiss symptoms like temporary dizziness, numbness in the face or limbs, or brief episodes of difficulty speaking as just getting older or feeling off for a moment. Why it matters: these symptoms might actually be signs of a transient ischemic attack TIA, commonly called a mini stroke. A TIA occurs when blood flow to part of the brain is briefly blocked or reduced, causing stroke-like symptoms that usually resolve within minutes to hours. Although the symptoms may vanish, a TIA is a critical warning signal. It means a full, severe stroke could be imminent if preventive action isn't taken. What you should do instead: never ignore these signs. If you experience any of the following: sudden weakness or numbness on one side of your body, trouble speaking or understanding speech, sudden dizziness or loss of balance, sudden severe headache, without a known cause, make a note of exactly when the symptoms began, how long they lasted, and any other details. Then call your doctor immediately and use clear language such as, "I think I may have had a TIA." Early diagnosis and treatment after a TIA can prevent a major stroke. 5. Inconsistent medication habits. What happens? It's common for people, especially older adults, juggling multiple pills to skip or forget their morning medications, particularly those prescribed to control blood pressure, cholesterol, or prevent blood clots. Why it matters: medications like antihypertensives, statins, and blood thinners act as essential armor against stroke, especially during the morning hours when your body's blood pressure and clotting risk naturally increase. Missing doses can leave you dangerously exposed to the risk of vessel damage or clot formation. What you should do instead: make taking your medications a non-negotiable, ingrained part of your morning routine. Use practical tools such as a pill organizer to sort your medications by day and time, setting a daily alarm or phone reminder. Taking your pills with a full glass of plain water to help swallowing and absorption. B. Creating a reliable routine. You significantly reduce your stroke risk and improve your overall heart and brain health. 6. Flooding your brain with stress. Immediate. Tell you what happens. Many people's first action after waking is to check the news, emails, or social media on their smartphones or computers. While it's natural to want to catch up, this habit can set a stressful tone for your entire day. Why it matters: reading distressing news or immediately reacting to emails activates your body's stress response, releasing the hormone cortisol. Cortisol raises your blood pressure, causes your blood vessels to stiffen, and increases inflammation, all factors that can damage your vascular system. Starting your day in this heightened state of emergency mode can strain your brain and heart before you even get out of the house. What you should do instead: create a no-stress buffer zone for the first 15 to 30 minutes after waking up. Resist the urge to look at any screens. Instead, engage in gentle, calming activities like deep breathing exercises, gentle stretching, or yoga. Listening to soft, soothing music, enjoying a quiet cup of herbal tea. This intentional calm start helps keep your nervous system relaxed and your blood pressure steady, protecting your brain from unnecessary stress-induced damage. 7. Neglecting physical movement early in the day. What happens after waking? Some people remain sedentary, sitting for prolonged periods without light movement. Why it matters: extended inactivity can slow circulation and encourage blood pooling, which increases the risk of clot formation in your veins. Combined with other morning risks, this sedentary behavior can contribute to stroke risk. What you should do instead: incorporate light physical activity soon after waking. This doesn't mean jumping into intense exercise, but simple, gentle movements such as walking around the house for 5 to 10 minutes, doing light stretches. Performing balance exercise movement stimulates circulation, supports heart health, and primes your body for a healthier day. In conclusion, small changes save lives. The good news is, preventing strokes often comes down to making small but consistent changes to your daily habits. None of these tips require drastic lifestyle overhauls or expensive treatments, just a little mindfulness and routine adjustment. Start with just one habit. Maybe it's drinking a glass of water before coffee or sitting on the edge of the bed before standing. Over time, these simple actions accumulate into a strong defense for your brain's health. Remember, your brain is your most precious asset. Protect it by treating your mornings with the care and attention they deserve.